Financially immaterial. That's how Raymond James analyst Michael W. Freeman described the inquiry into Well Health subsidiary Circle Medical's billing practices by the U.S. Attorney's Office. Nonetheless, shares of Well Health, ticker symbol WELL on the TSX, gave back much of their recent gains. Well, that, says Freeman, spells an opportunity for investors. And here to talk about that development and the outlook for the rest of 2025 is Well Health CEO Hamed Shahbazi. It is so great to see you again, Hamed.
Great to be with you, Brandy. Thanks for your time.
So, analysts have called for investors to look beyond the accounting noise in your fourth quarter and annual results. So, first, can you briefly explain what accounting noise this is and why you think investors should look past it in 2025?
Yeah, no, for sure. I'll first start by saying that we had a phenomenal 2024 fundamental performance. Our patient visits grew by 32% overall. The vast majority of that came from organic growth. That is the centrifugal force of our company, our patient visits, delivering service to patients and driving better patient outcomes. We did that, and we got paid for it. We generated around $50 million in free cash flow. We did have a couple of instances of IFRS impact to our numbers. These are two one-time items. One is related with a controlled, non-fully owned subsidiary called Circle Medical down in the U.S. And we had about $53 million of deferred revenue into 2025, and $3 million will go into 2026. And that deferred revenue will be recognized again 1 year after those revenues were recognized here previously in 2024. Again, it's important to recognize that we delivered these services, but again, under IFRS, in consultation with our auditors, there was a belief that this would be the appropriate treatment for those revenues. And so it's important to note that, and we'll talk a little bit about our guidance. This will cause significantly improved guidance for 2025, and it's important to keep that in mind, given that the impact it has on EBITDA as well. And then we had a $24 million one-time impact related to our Change Healthcare cyber attack matter at CRH Medical. Again, this is a matter that hundreds of companies were exposed to as a result of the Change Healthcare revenue cycle management platform being down from February to July of 2024. And so you could imagine those companies could not do with respect to not collecting all of those funds from their revenue cycle manager, which they rely on for their revenue and their cash flow. So Change went to an affiliate of theirs within United Healthcare, and they then fronted or advanced cash related to all those collections until they could catch up with those collections. And essentially, by the end of the year, they had not caught up with all those collections yet, and we're looking forward to those collections being caught up. But meanwhile, we have the cash, and so this is why it did not affect our cash flow. So it's a very nuanced issue. Both of them really, they're absolutely not fundamental to the performance of Well. They're really related with IFRS 15 revenue recognition, and it's important for, I think, investors to be aware of that. And I think that's generally been the message from analysts.
And I wanted to talk to you more about that EBITDA because as you mentioned, you set record guidance with your last earnings release for both revenue and EBITDA. So can you talk about some of those key drivers that went into that guidance?
Yeah, so our guidance for this year, our official guidance is 1.4 to 1.45 billion in revenue. And keep in mind that there's about $50 million worth of deferred revenue that will land in 2025. So if you strip that out, if you want to normalize it for cash, we're talking more 1.35 billion to 1.4 billion. And also on the EBITDA line, our official guidance was 190 million to 210 million. So the midpoint would be 200 million in adjusted EBITDA. Again, if you sort of take out that deferred revenue, you'd be somewhere in and around the $150 million range, which again is a substantial increase in growth from the sort of denoised figure of 127 if these revenue recognition impacts hadn't occurred. which was, compared to the previous year before that, that was 113.5. And then before that, the previous year was 104, 103.5, somewhere in that range. And so you can see this very consistent growth in revenue and EBITDA in our business. We've been incredibly consistent. Until last quarter, we'd never missed as a company at all. We never missed our guidance, and probably half of our last 20 quarters we'd probably beat and raised. And it's important to note that if you take out those revenue recognition IFRS impacts, we would have actually met our guidance again and beat our guidance again. So I think that's really important. The other thing that's in that guidance is we now, as of April 1st, have exercised our option to acquire the multi-voting shares that we had set aside for Healwell. So Healwell AI in Canada now by revenue is the second largest health tech, sort of company, pure play company in the country. So we're really proud of the fact that we are the largest shareholders. We own about 69% of the voting of the votes of that company, and as well the voting stock, and about 30% on a fully diluted basis, the economic value of that company. So it is now being consolidated under Well as of April 1st. So you'll see $120 million contribution towards that. And then really, it's the rest of it is really our organic growth, and we'll likely have additional acquisitions that will be added to that. So there's a very decent chance that we'll continue to improve on our guidance as we have in the past. And we're very pleased with the fundamentals of the business.
I also want to touch on a little bit more. You just mentioned announcing Healwell's financial results being consolidated this year. So how does that relationship between Healwell and Well work, and what synergies is Well looking to try to capture with Healwell's AI and technology?
Yeah, well, I'm glad you asked. I mean, we are really, we're one of the founders of Healwell, along with the management team and the founders of MCI One Health. When that company, when we acquired their clinics and we repackaged the rest of the company as Healwell, obviously with the brand extension of Well, because we established a path to control transaction. So we've been essentially running this company and driving it and really helping to do whatever we can to support the business, including lend corporate development resources and ideas. And myself, I joined as chairman of the company at the beginning of the journey. Within 18 months, we've taken the company from less than $10 million in revenue to a run rate now of 160 million and profitable. At the time, at less than 10 million, it was losing a significant amount of money. And so we're very proud of that. We've raised $150 million together with the management of Healwell together, and we've acquired 6 companies, and the last company that we acquired is a very significant company. It's called Orion Health. Orion is a global leader in healthcare data interoperability. And so what is that? That is essentially helping large enterprises, large public sector groups, governments, provinces, regions with managing and normalizing their healthcare data. So they'll go in and they'll take numerous data silos and sources. They will break those down into a substantial data lake. They will normalize it. They will then create dashboards, and they will ensure that there is an active movement of data in there. And so it becomes an incredibly important resource for the public sector client. And in an age and time when everyone wants to use AI,
Yes.
it's really not possible to do so until you have your data figured out, until you have really undertaken to create this interoperability and bringing all those different disparate sources of data into one source. And so you can just imagine how important that is now. And so it is really a very significant data science company, and it has rolled out these technology solutions to 70 clients in 11 countries. So now, Well, by virtue of its ownership of Healwell and Orion, is a multinational corporation with boots on the ground in 11 countries, serving the NHS, the governments of France, Spain, Saudi Arabia, United Arab Emirates, New Zealand, Australia, Northern Ireland, Scotland. I mean, it's really a very impressive company doing roughly 100, probably over $100 million in revenue this year. Majority of which is SaaS, and with great margins. And so that is now part of the family, and is really transformational for our group.
Congratulations on that development. I also have to ask you about a trend here. You've talked about the growing Buy Canadian movement in healthcare. How do you think Well is positioned to benefit from this trend? And what opportunities do you see in the Canadian market going forward with this?
Well, the vast majority of uh, procurement of major digital health software and technology, again at the federal and the provincial level in Canada, really would go to American companies in the past. I know in today's world that seems kind of nuts, but that was just the norm. And Canadian companies, even though many Canadian companies would have the right solutions and products and services that could compete effectively, would typically not be involved, and would get much smaller contracts and mandates. And so I think it's been very clear now, since all the geopolitical tariff challenges that we've had, that there's a real Buy Canadian mandate coming from the government. This has been very clearly articulated by the various different premiers of the different provinces. And we're seeing just a monumental sea change in attitude towards Canadian vendors. And look at the scale of very large procurement, where you're supporting provinces at scale. There are not that many companies that can support that. Surely there are Canadian companies that can do that. We are one of few companies that have the ability to support large scale procurement in terms of data operability with the Orions of the world, in terms of all kinds of different digital patient engagement solutions. So we're very excited about that. Our pipeline has grown tremendously. We've probably gone from 100, less than 100 to well over 300, probably close to $500 million worth of total pipeline just for our technology solutions between Well and Healwell, in Canada alone. I also think these geopolitical issues could cause a substantial opportunity for a Canadian company like ours, as the U.S. goes through its own tariff challenges with some of these companies. Again, there could be a preference for non-U.S. Vendors, which I think could benefit us, given that we have such a capable product portfolio now in digital health. From provider technologies to electronic medical records, to data interoperability, to best-in-class AI, disease detection, ambient AI scribes. I mean, it goes on and on. I could be here till tomorrow morning talking to you about all the features and products and capabilities of our platform, but we are truly a very capable company now with a very deep skill set. And I think that's going to be very valuable both in Canada and abroad.
Hearing about all of these changes, I now have to ask you what excites you most then about 2025, and what you think investors should be looking out for in this year of so much happening.
I agree. I mean, look, I'm very optimistic. I mean, I think, again, coming back to our fundamentals, they're very strong. You look at our patient visit growth. One should think about Well's patient visits in the same way that you look at Tesla's car deliveries. They are essentially the core and key and underpinning of revenue. And so, if vehicle deliveries are healthy, then so is the company. And our patient deliveries, our patient services are incredibly healthy. There's a demonstration of the platform really working. We have elevated organic growth. We have, a really strong platform, and, we're just going to continue to execute. And I think you're going to see another year of record revenue, record EBITDA, and record cash flow. And I'll also say, I think with all that's going on in the world, and us not being directly impacted by tariffs, because we don't have any cross-border products and services. Our U.S. businesses are domiciled in the U.S. They have U.S. employees, and so that's not really impacted by the tariffs. I think, with respect to our international expansion potential now, I'm also quite excited about that.
We certainly wish you the best. Well Health CEO Hamed Shahbazi, thank you again so much for being here.
Thank you. It's great to be with you. Thank you.